Hi, my name is Maddie. I'll be your nurse today. So what brings you in today?
So I've been having really severe pain in my lower abdomen and constant bloating and some vaginal spotting, but I'm not supposed to be on my period at all. And this morning I woke up with extra severe pain, so I decided to come to the emergency room.
Okay, yeah. So when was your last period? And if you are, when were you last sexually active? And if so, was there any pain?
So my last period was about like 2 weeks ago, and I was sexually active last night, and it was super painful during.
Okay, yeah. So with everything you said, we're just gonna go run some tests. We're gonna run a blood test, and we're gonna bring an OBGYN in here to talk to you.
Perfect, sounds good, thank you.
Hi, I'm Dr. Maddie. I'm going to be your OBGYN. So your test results came back and you have elevated levels of testosterone and prolactin, which is an indication of polycystic ovary syndrome.
What is that?
So what even is PCOS? So PCOS is polycystic ovary syndrome, and that's when
The ovaries produce an abnormal amount of androgens, which are male sex hormones, and can cause little to no ovulation, which then leads to cyst development in the ovaries.
What are some signs and symptoms of PCOS?
the first sign is weight gain, especially in the abdomen,
Having acne or oily skin,
having irregular menstrual cycles,
and finally having excess body hair, especially on the chest, back, and stomach. Okay, I'm going to order an ultrasound to check for a ruptured cyst just because you're presenting with some of those symptoms. Okay, so it looks like you do have a ruptured cyst. I'm just going to get you on an IV for some fluids and some pain meds, and I'm going to prescribe you oral contraceptives to help with your PCOS symptoms.
Okay, and how is that going to help my PCOS symptoms?
One of the hormones that's unusual in PCOS is testosterone. So women with PCOS typically have a much higher total testosterone than people without, and this causes the dysfunction in ovulation, many of the cysts, and it also causes symptoms such as excess body hair and acne and some weight gain.
So what is LH and what is FSH? So LH is luteinizing hormone, and that produces steroids which help control ovulation. And FSH is follicle stimulating hormone, and that is produced to help control the menstrual cycle.
So what are these levels for PCOS?
So someone without PCOS, there's typically a 1-to-1 ratio of LH hormone and FSH hormone in the blood. So if you can see over here, there's typically not that big of a difference between LH and FSH hormone in the body. And then someone with PCOS typically has higher LH ratio compared to FS ratio. So typically that's a 3-to-1 ratio in the body. And with this, having too much of the LH hormone, this creates ovulation to not occur.
And I'm going to prescribe you oral contraceptives to help with your PCOS symptoms.
How do oral contraceptives help with the symptoms of PCOS?
So first, oral contraceptives, they help lower LH levels, which just help you ovulate more consistently.
They reduce androgen production.
You maintain a regular menstrual cycle.
They help reduce hirsutism, which is excess body hair, and acne.
Is there anything else I can do to help with my symptoms?
Yeah, come with us. I'm someone with PCOS and I need to go grocery shopping. Some of the foods I want to avoid are foods high in sugar, such as cereal and sugary drinks. I want to avoid saturated fats and red meat, and then anything processed, because all this is going to do is give me a lot of inflammation and make me not feel good.
So I'm gonna go shop for foods that are high in whole grains, high in protein, and low in saturated fats. And these foods are just gonna help me feel not inflamed and just feel my best.
We're here, come shop with us.
Wow, these look really good. Can I have these?
Those are great in moderation, but what if we incorporate more fruits? It'll make us feel better. Which one of these will make me feel better?
Definitely the whole wheat bread.
What about hot dogs?
So hot dogs are great in moderation. Those have high saturated fats. Let's try to eat some good proteins with healthy omega-3s and healthy fats such as salmon.
Okay, I'm a little scared. Am I ever going to be able to have kids?
Yeah, so it's definitely a little bit harder for women with PCOS to have children, but that doesn't mean that you can't. Just with women with PCOS, they do have more issues due to having trouble ovulating and having low progesterone in their body. But with a healthy lifestyle, physical activity, and taking medications to make their ovulation more regular, your chances increase of getting pregnant.
Whenever you're thinking about having a baby, you can always come to me and I can prescribe you some medication for ovulation.
Okay, perfect. Thank you so much. PCOS affects 1 in 10 women.
It's super normal and nothing to be ashamed of.
The resources listed on the pamphlet can help with overall emotional and nutritional support.